EMS business is unique. It's very grassroots. In order to be successful in the EMS business, it takes a local brand, local community, local employees, local consumers, and oftentimes its association with healthcare in general, it takes on sort of the community's interest in terms of public health. So it's a very grassroots business, and so sometimes there's agencies that really just need some expertise coming in, perhaps redesigning, finding better efficiencies, finding newer innovative ways to perform, the EMS company to perform, but they want to pull back from a grassroots level and have someone internally and locally perhaps to manage it.
Well, I think in the past, hospital systems have allowed patient transport to occur by providers that were not affiliated with the hospital. They control a lot of volume, and that was a revenue stream that they didn't see available to them. Parastar presents a business model where the hospital system is able to recognize a revenue stream from volume that they already control.
The best example I can give is our partnership with Oakwood, and they're one of our first joint venture partnerships. They were a large system of 6 hospitals in Michigan, southeast Michigan. They provided an array of transportation services for psychiatric daycare patients, moving patients from one facility to the next, transporting employees from parking lots to the facilities. So they were managing all these different levels of transportation and outsourcing ambulance work to a private provider. We met with them about 12 years ago, set up a model for them that we had an equity stake in it, and put together a all-inclusive transportation model for them, which we managed all their needs internally. The system realized $1 million savings on just the non-medical logistics within the first couple of years. As the system grew and we started to provide more ambulance transportation, fee-for-service ambulance transportation, we started to share in earnings of a couple $1 million a year. So the net impact to that particular system was a couple $1 million a year.
When a fire department calls us, or when a hospital EMS system calls us and says, look, we know we've got to make some changes. Maybe quality is not where it needs to be. Maybe earnings is not where it needs to be. Maybe community interest isn't where it needs to be. We need someone to come in and give us a snapshot of current state. I think we're the best equipped to do that. We can do it from a benchmarking standpoint. We can take a look at, put a team of consultancy, diverse consultants, team of experts on the ground that can take a look at current practice and put it up against best practice. And really be able to provide what I feel in the past I think are some of the best robust reports in terms of recommendations for models of opportunity. And the beauty of our organization is, again, and I've talked about this before, is that obviously, we're happy to provide that report to a senior team and actually stay on the ground to help roll those recommendations out. We feel that strong about it.